Hello, Summit participants. Thank you for joining us here today. I'm Stephen I. Weiss, Senior Staff Writer at Inc. Magazine. I'm joined today by Glen Tullman, CEO of Transcarent, formerly of Livongo and Allscripts. Glen, thank you for joining us. Most of your work has focused on healthcare. You're currently at Transcarent. You were previously at Livongo and Allscripts. And in the United States, this is a country where healthcare provision has often been unfair and inequitable. So how do you bring a sense of purpose to healthcare companies in that context?
I've been fortunate in two respects. One, to spend most of my career in healthcare. And by working in healthcare, you're doing something that really, if you think about recruiting people and convincing people to come on board, healthcare touches everyone. So it is, in a sense, by definition, mission driven. And then the companies that I've been fortunate to lead are all very directly driven in that respect. So for example, at Allscripts, we were doing electronic prescriptions. And we knew from the Institute of Medicine study that every time people converted to electronic prescribing, they saved lives. Similarly, at Livongo, we knew that we were empowering people with chronic conditions like diabetes to live better and healthier lives. And we could measurably prove it, which is rare in many cases, but we could show that people on our system had better A1Cs, had better results. So we've been able to use that to help motivate and give purpose to all of our businesses. And that helped us in knowing what to do, in knowing how to run the business, and in recruiting people as well.
And is there a sense in which you use that mission as a healthcare company in this context to talk about healthcare in the country overall and where it should be going?
It is. The reason I do this, what motivates me is a simple fact, and that is I know we can do better. I know in this country, everyone deserves to have high quality healthcare that's affordable. And many of the practices that we have today don't promote that. People make money from doing the wrong thing. So we think there's an opportunity to use technology and smart business redesign to change that, to make healthcare more affordable, to make it higher quality, and to make it more equitable. And even simple things like copays. You look at copays, every time you could put a copay on something or coinsurance, you actually reduce the utilization of it. And who's most impacted? It's the lower economic groups in our society. So in our services, particularly at Transcarent, what we're doing is we're eliminating copays, we're eliminating coinsurance. And by the way, coinsurance is the number one cause of bankruptcy in the United States, and that's healthcare. And we have to fix that. So all of our companies have been focused not only on delivering better care, but doing it in a more equitable way.
And you've talked about the work that you're doing at this company and prior companies and how a lot of it is algorithmically driven. And algorithm work has come under a lot of scrutiny as well for questions about fairness, questions about how it works. What are you doing to audit the algorithms and the algorithmic processes at your firms to ensure fairness, to bring purpose to that work?
The good news is we're using algorithms to personalize and to drive better care. And we do that independently of knowing who we're doing it for. So the beauty of what we're doing at Transcarent is, let's say you needed surgery and you're working at a top quality company like Target. Whether you're the janitor, a truck driver working on the floor, or the CEO, you get exactly the same access to high quality, high value care. And that is an option to get care locally with quality ratings, to get care remotely, and we'll pay to fly you to another location. So everything that we would think of as an executive getting, now all of a sudden it's available to anyone. Why do we do that? Because companies like Walmart led the way in studies that showed that if you get people high quality care, they will have better results, it'll end up costing less, and they won't get unnecessary care. You know, in this country, a third of all the surgeries done are unnecessary. That's data coming from physicians and the medical establishment. So in that case, we know that if we can add quality to the process, everybody wins.
And is there a sense in which you try to unbias the situation that you find yourself in, where we know that many studies indicate differential outcomes, differential diagnosis for different racial groups, different economic groups, and that you try to bring that to your algorithmic processes as well?
We do, because we look, in one respect, we're very personalized. In another respect, we look at everybody equally. So there's no differentiation in benefit for us. So everybody gets the exact same care. For example, if you need to talk to a doctor 24 hours a day, you can do that in 60 seconds by just looking at your phone and touching a key. There's no sign-on, there's no copay, none of that. So everybody has that exact same access. Similarly, if you want to get surgery, as I mentioned, or let's say there's care that you want to receive at home, you're in a rural location or an inner city location, we can get you that care from top experts around the country because we're delivering it digitally. So I think, when you think about digital care creates abundance. Like, everybody in the world can use Google equally, right? And, it doesn't matter where you are. You need is a phone. You do need a phone to use that. Now, in our system, you can even call. So even that, if you didn't have a phone, you'd still get access to the same great doctors, great facilities, and great care. And we have a big effort to deliver care at home. So in many cases, rather than going to the hospital, we'll come to you, and the costs are actually lower. And if you look at another reason people don't get care, it's travel. My mother used to ask me, she used to wait. She lived in another state, wait till I came in to town to take her, because she was embarrassed to ask somebody else to take her. And those were pre-Uber days. But even so, a lot of our elderly population isn't comfortable with Uber. So what can we do? Well, imagine if the care came to you like it was in the old days. So we're using technology to do a little bit of back to the future stuff, where we can get you that same personalized care at home that we dreamed about, we heard about years ago, in a high quality, cost-effective way.
And you're talking about how healthcare has changed a lot over the last couple of years, and a lot of remote care and so on and so forth. In addition to that, our audience here is mostly business leaders at non-healthcare companies. What should they know about how the healthcare landscape has changed over the last couple of years as they're leading their companies today?
If you think about it, over the last 20 years, payers promised us three things, the big payers. They promised us a better experience, they promised us better care, and they promised us lower or affordable cost. And they failed at delivering all three of those. So then we had navigators come along, and they said, we'll help you navigate this broken healthcare system. That didn't work. We then had point solutions come along, like my former company, Livongo, who said the diabetes care being provided, the hypertension care being provided is so bad that you should pay us separately. And companies did in droves because they knew it was bad. They knew the care was bad. And that's true whether it was behavioral health for adolescents, whether it was any number of different pieces of the medical equation. But then there were so many point solutions that companies said, this is becoming more complicated and harder to manage than we ever imagined. And the individuals were saying, healthcare has become more confusing, more complex, more costly than ever before. That's why we created Transcarent, to say in one place, you can get all the healthcare you need. And you can get that from people who really care about you, who are focused on quality first, not cost first, but quality first, because we fundamentally believe we can do it better. And this has happened in every other industry. I mean, think about Travelocity. We used to have to go to a travel agent to get a paper-based ticket. And then Travelocity said you can get it 24 hours a day. You can get unbiased information, trusted guidance. We'll make it easy for you to book a ticket. Everybody loved it. Think about what Uber did using technology. Think about Airbnb, how they became the largest travel company in the world by simply connecting you to the people who wanted to rent their place. And now in healthcare the middle has gotten bigger. And what's the middle? It's denials, it's friction, it's billing. All those things, they don't help get you healthy. And so we're saying, what if we went around the middle, directly to the people providing care? Because at the end of the day, we think there's only two players who matter in healthcare. That's all of us as healthcare consumers, And that's the people who actually help us get better. Doctors, surgeons, behavioral health therapists, and nurses, and all the professionals who helped us get through the pandemic, and they will help get us healthy. But we got to pay them better, we got to treat them better, and we got to shrink the middle, which is taking a disproportionate amount of the profit and causing a disproportionate amount of the pain in healthcare. And Transcarent is about going around that and making it easier to stay healthy.
And when we talk about that other group, the not consumers, the providers, they've been going through a very stressful 2 years during the pandemic. We've been seeing massive amounts of exhaustion, massive amounts of utility, massive amounts of people feeling like they need to leave the field. As a healthcare intermediary, right, what do you see going on in the healthcare provision space in terms of the talent pool, and where do you think things need to go?
This is an enormous problem. We're just seeing the front end of it. We see a lot of our doctor base is older, they're retiring. A lot of our younger doctors were very discouraged through the pandemic about the enormous efforts they made and the lack of appreciation. Initially, we appreciated them. After a period of time, it almost got reversed. And then our nurses who have been exhausted. And so as I talk to healthcare systems around the country, they have dramatic nursing shortages, doctor shortages. The costs have gone up dramatically. And again, I think we're going to see enormous inflation in the cost of healthcare, in part because of this. So we need to use our doctors and our nurses and our caregivers and other professionals more effectively. We need to treat them better. We do need to pay them more. And where are we going to get the money to do that? It's got to come out of the middle. We've got to drive more efficiency into the process. And again, that's what we're doing at Transcarent. And I hope we're going to be joined by a lot of other companies who are focused on making our healthcare system more equitable, more affordable, and higher quality.
But insurance companies have had their profits capped for a long time, right? So what more is there to take out of that other than a different model? Or is there a different model that actually really has to be the way we go forward? Or what do you think happens there?
I think there's two answers to that. One, they haven't really had their profits capped. If you look at the profitability of insurance companies, it's been on a steady climb upward. And so they figured out other ways to generate those profits. That's number one. Number two, the overall expense isn't just about profit. It's about all of the administrative waste. So when you get a bill, and let me just ask you a question, have you ever received a healthcare bill that said, this is not a bill? Most people have. And that's just ridiculous because you didn't want to know what it's not. You wanted to know, what do I do with this piece of paper? And when it says you may or may not owe this amount, what does that tell you? And so there's all this administrative confusion that they add. If you ask doctors, they will say they waste more time fighting with payers than they do treating their own patients. They waste more time fighting with payers than they do. We educated these folks. They're the smartest people we have. They're the most caring people we have, and we're killing them in administrative paperwork. So there's a cost there too. It's not just about profits. It's about, why do we need that middle? What if we said to people, you need heart surgery, we're going to get you heart surgery at the highest quality place we can, because overall, that's the best economic decision for our society, and it happens to be the most equitable decision for our society. So everybody, once we determine they need care, should get the care they need. And we can't afford it. We just have to eliminate all the waste. We know that, again, in testing, you go out and you get an MRI and you get it from your doctor, and then you go to the hospital and they need to do another MRI because they can't get connected to the first one. And that's just waste. If we squeeze that waste out, we put people back in charge, we consumerize healthcare, then we're going to see the same efficiencies we've seen in every other industry. And this happens to be the most important one.
Understood. Well, Glen Tullman, Transcarent, thank you for joining us.
Thank you. Thanks for the time today.